What I'd like to start with is going back to EMDR. If you could explain for us EMDR, and then since you practiced that for so long, and then you discovered this new therapy that you're saying is better than EMDR, and I can tell you that David Pickup says the same thing.
Eye movement desensitization and reprocessing was discovered by Francine Shapiro when she realized that when she focused on a negative event, negative memory, and she moved her eyes horizontally back and forth saccadically, that it reduced the intensity of the image and of the feelings. And from that start, she eventually developed, actually for that time, the best treatment for trauma. And her first paper, her first research was on combat veterans, and showed how much it worked to reduce their PTSD.
Let me interrupt for a second. Could you maybe just pull the computer a little bit closer to you? I think we'll get a little bit better sound.
Oh, okay. Maybe this would be better here.
Oh, yeah. That's 1,000 times better. Yeah.
Okay.
So she discovered EMDR, and that's an interesting story. She did it simply by herself moving her own eyes back and forth.
That was her first discovery. That's how she first discovered stuff. Yeah.
Wow.
And she was looking for a way to relieve stress in general. She was a research psychologist, and she was looking for a way to release stress, and that was like the beginning of it. And when she realized, she then took that experience that she had and then ended up creating really an amazing therapy as a result of it.
And am I right that it is based on this theory that during REM sleep, your eyes do a rapid eye movement left and right, and it's kind of a resetting of the left and right brain?
Nope.
Okay. Well, I've been telling that to people at bars over and over again, so I had that part wrong. So correct that for me.
Well, the one thing we do know, number one, we really don't know why EMDR works. It seems like, every 5 years they come up with a new theory about why it works. But it's not based on a theory, it's based on clinical experience. And that's what's really important. It's not based on brain science. It's based on having discovered something that when you focus, when you move your eyes back and forth in a saccadic movement and you're focusing on a negative memory, then it reduces it. That's the experience. Brain science has not caught up with why things work. We don't know why really psychotherapy works in terms of brain science. We do know it does work.
Okay, so it could have some correlation to REM sleep, but we just don't know.
Well, one thing we do know is that one bit of research is that when you focus on any intense imagery and move your eyes back and forth, it activates both hemispheres of the brain. That's actually, even without, I think, focusing on any particular image, if you just move your eyes back and forth, it activates both hemispheres of the brain at the same time. So it's one reason why they use the eye movements in occupational therapy for people who've had concussions.
And why do your eyes move back and forth during REM sleep, if you know?
From what I've heard, it's about information processing. So is there a connection? Maybe, but I'm not sure if we really know for sure.
Mm-hmm. But bottom line, it was very successful, and the way it was used was having, and let's use the example of the soldier coming back from the war with PTSD, taking that soldier back to the traumatic incident, having him rethink it, talk through it while he's moving his eyes?
To see it, yes. They don't have to be talking through it at the time, but they invoke the memory again. They remember that memory, and then move their eyes at the same time. Yes.
And was a laser involved?
No.
Okay. I thought that somehow you would use a laser to help the person, follow the laser back and forth kind of thing.
Well, that's a later thing where you're just doing the eyes. What we used, and what I used almost all the time, was either my hand or a wand.
Okay. So
like
in other
a
words,
conductor wand.
gotcha. So follow it back and forth.
Yep. Anything that would help move the eyes.
And by the way, for soldiers coming back with PTSD, is it usually associated with an isolated event that happened during war as opposed to just the broad experience of being under so much pressure?
It's both. I worked at Camp Pendleton for 4 years, working with active duty Marines and Navy who had come back from Iraq and Afghanistan with PTSD. And it's a whole bunch of things. There is both single incidents that they remember very intensely. And then there is the whole issue of being, let's say, 7 months in country and not being in a dangerous situation and being hyper vigilant the entire time and also getting very little sleep at the same time.
I mean, the other thing that you hear about veterans coming back is this just broad sense of depression / guilt, and feeling out of place with coming from this environment where you're with your guys and everything is about your guys and working together in survival, and everything is life and death. And then when you come back, and I'm thinking about the movie American Sniper, where, now the guy's pushing a cart through a grocery store. It's just, everything is just so different. And you feel guilty also about the guys that are still there risking their lives while you're back, at Vaughn's shopping in the fruit section. Is that a form of PTSD that these guys are going through, or is that kind of just really a
there's a lot, it's saying it's PTSD is to simplifying it. There's just a whole bunch of different psychological dynamics at play. They form very deep bonds with the men that they're with over there. And there's also in combat, there's a really intense feeling of belonging, of connection, because your life depends on your buddy and your buddy's life depends on you.
Yeah, and that's all the good part. So, but when you get back home, how does that manifest itself negatively? It
can be really depressing, to say the least. And one of the things that happens is I know that there were guys who the PTSD did not materialize until they were reassigned to a unit that was a new unit for them, and all of a sudden those memories came flooding back. And usually what happens, they come back, they're glad to be back, and over a period of just a few months, that's when a lot of the memories start to resurface. And now they're in a safe environment. When you're over there, the adrenaline is so intense all the time that for the sake of your survival, which is why the adrenaline is going on, everything is suppressed for the most part, for most people.
And would you describe that also as a form of a high?
Oh, it's adrenaline high is there's something that I call combat addiction. And it's where they want to go back. They want to do it again because there is nothing makes them feel more alive than being in combat. You get this adrenaline high. And then when they come back, too often, they even warn them, don't buy a motorcycle because they're looking for that adrenaline high and they're not going to get it like they did. And that can be very depressing. And some of them volunteer to go back in order to get that adrenaline high, knowing how dangerous it is.
And that really is something different than PTSD then?
Yes, that's the feeling state.
And is the treatment that we're about to talk about, ImTT, is that really just designed for PTSD and traumatic events, or is that something that also could treat what you're talking about with this adrenaline high?
Well, it's important to understand that, okay, let's look at, instead of looking at names, let's look at psychological phenomena. We know that trauma is a psychological phenomena. It took us a long time to discover that phenomena. In World War I think it was battle fatigue shell shock. World War II, it's battle fatigue or this, and they realized that there was something. That was when psychology discovered that, hey, there's something, people can be traumatized by what's going on. But between the wars and after the wars, they actually forgot about the effect of trauma on the person's psyche. And it wasn't until really the Vietnam War that they realized that the impact of trauma on a person, not just military trauma, but eventually civilian trauma as well. And so we actually had to discover and to develop an actual concept for the psychological impact of traumatic events on people. Okay? What I did back in 2001 is I discovered the feeling state. That is, why do people keep doing something like that? Why do they do addictions? And it turns out that there is a positive, while trauma is a fixated negative memory, there's also can be a fixated positive memory. A good example of that is somebody who gets addicted to heroin, and they have this memory of euphoria, and that memory has become fixated. So they keep what they call chasing the dragon. Chasing the dragon means that they're chasing that feeling they got the first time they used the heroin. But it turns out that feeling states, or that fixated positive memory, is not just about drugs. For example, gambling. So I had a man who was a social gambler until he won a really large hand playing Texas Hold'em. And he won, and what he felt was this intense feeling of being a winner. And so for him, the feeling of being a winner got linked or fixated with playing Texas Hold'em. And the problem with fixated memory is once it's fixated, it doesn't go away. So he lost $1 million in 10 years, but it didn't change that fixated positive memory.
So to interrupt for a second, similar to a traumatic event, it was a dramatic positive event.
Correct.
Mm-hmm.
Okay. And what I discovered was that's what I called a feeling state. And a feeling state is just as intense a phenomena as a traumatic fixated event that causes PTSD.
And can result in addiction.
Yes. I mean, what you're looking at when you're looking at porn addiction, or you're looking at sex addiction, or shoplifting addiction, or marijuana, or alcohol.
Or not shoplifting, just regular shopping.
Shopping addiction is also...
You buy a Ferrari.
That's right. And so anytime somebody has a fixated positive memory, it creates a compulsion to do that specific behavior in order to get that feeling.
But let me interrupt there and ask, that doesn't happen for everyone, right? So there's something going on for the person who wins the big hand at Texas Hold'em and has this euphoric feeling, and then chases the dragon, so to speak, of having that feeling again, where it essentially becomes an addiction. That happens to not everyone, obviously, who wins the big hand. So what type of person is it that's happening to? Is it somebody who has their own childhood trauma or issues prior to that?
The answer is, of course, yes. What underlies the person who had the gambler who had a really intense need to feel like a winner had a problem that he had a very intense feeling that he was a loser. He had that feeling of being a loser because his father had called him a loser.
So for the person who is okay psychologically and they win the jackpot, they're going to have a normal reaction, which is to celebrate, have a drink or two, but then go back to their everyday life.
That's right.
The person who had the negative feelings about themselves, that euphoric feeling, they really need that.
Yes.
They need that again.
That's exactly right.
Mm-hmm.
And so you have to do two things, though. You can't just solve the trauma, because once the feeling state is created, once that fixated positive memory is created, clearing the trauma doesn't make the feeling state go away. It's now its own separate fixated positive memory.
And the same thing would apply to drugs or alcohol. So the person who's not feeling good about themselves, they have a drink, they finally feel good, and now they get fixated on having another drink because they're remembering how good it made them feel.
Well, yes. One example here is that many times people start drinking either in high school or college, and they start drinking with their buddies. And so there's a deep feeling of camaraderie linked with drinking. And so even though years later they're not drinking with those buddies anymore, whenever they take a drink, they feel that sense of camaraderie, and that's what they're looking for. And the solution,
but again, they had to have had some underlying issues to begin with.
Well, that's partly it. I mean, certainly, they do have a real intense need from camaraderie, but there's also a very intense need at different times, different psychosocial needs at different times. But probably if a person has a healthy childhood and doesn't have intense need for that feeling, then it will not fixate. Yes.
So, EMDR, I've always heard about for dealing with past traumas.
Mm-hmm.
ImTT, you don't go through the trauma, you go through the positive feeling, right?
No. Don't confuse. Okay. While I was doing EMDR, I developed the feeling state theory. And so I was using bilateral stimulation, that is the eye movement, to process the feeling state. So it went away. And that worked really well.
The traumatic feelings?
No, the positive feelings.
Okay.
EMDR, I used EMDR as Shapiro created to process the trauma. But you also have the feeling state, the fixated positive memory. Mm-hmm. And so what I discovered is by doing the same eye movement and focusing on the positive memory, that fixated positive memory, you could break the link between the behavior and the feeling. And so the person just stops doing that behavior. Okay,
let me just interrupt and ask this question. EMDR used to go back to let's say it's a childhood trauma, and to relive it, rethink it while you're doing the eye movement, that helps reduce that trauma. How is it that the same thing with a positive feeling, because normally you think you don't want to get rid of a positive feeling, but I guess what you're saying is, no, you do want to get rid of that positive feeling.
Sure, because you're locked into the past. What happens both trauma and feeling states is that you have an isolated, a memory that is isolated from experience. In other words, your experience you have as you go in life doesn't change that fixated either positive or negative memory. So that you may feel little and small and helpless when you're 5 years old and you're getting beaten up. You're 30 years old now, you're no longer small and helpless, but you still feel that way because the fact that you've grown up and learned to be able to handle your life doesn't change that fixated negative memory. The same is also true for fixated positive memories as well, the feeling states. Because so the gambler who lost $1 million in 10 years, that fixated positive memory of feeling like a winner when he played Texas Hold'em didn't change whenever he lost. He would feel bad about it. He would feel guilt. He would feel remorse about what he was doing to himself and to his family. But the memory was still there. And so, as the guilt and remorse kind of went away, the feeling state memory starts coming up, and he wants to feel like a winner again, and he goes back and does it again and play Texas Hold'em.
Okay. So walk us through exactly how ImTT works.
Okay.
Yeah, the process.
Image transformation therapy is fundamentally different from all of it. Let me explain kind of how the first time I ever did anything about it, the first event that set me on the track. I was working with a man who was suicidal because his wife had left him for another man. And he was in a lot of pain. And the thought came to my mind, well, the only reason he's suicidal is because he hurts. So if we could get rid of our pain, he wouldn't be suicidal anymore. And I thought of an old technique back from the 60s where you breathe in the good energy and breathe out the bad energy. And I decided to modify it. And so I said, what's the color of the pain? He said, red. And I said, where is it on his body? And he said, different places. So I had him breathe into the red and breathe it out of his body. And when we finished, he wasn't suicidal anymore. So what I discovered was that with a breathing visualization technique, you can release emotional pain from the body. And he was never suicidal again. And it just kind of developed from there. I also then, in my private practice, I had a child who was having multiple tantrums every day. And because of a very bad experience with her father, we kind of processed that the same way. The multiple tantrums dropped down to 2 a day, which was a huge improvement. Then I had a woman whose fiance had hung himself about a year before. And she felt incredibly guilty about that, even though it wasn't her fault. He was a veteran. And so she was a veteran. But at the time that he hung himself, there didn't seem to be any particular problems, but she found him hanging in the garage. And she had been having more problems with depression and drinking too much over the time. And no matter how many times her friends would tell her it's not her fault, she didn't do anything wrong, she couldn't shake the guilt. And so she came in for therapy, and I just had an intuition that if we cleared the pain underlying the guilt, that the guilt would go away. And it worked. We did the same basic breathing visualization technique, and all of a sudden this guilt she had been living with for a year was gone, never to return. And that was kind of like this. That was when I discovered that pain underlies guilt. And then I had a man who was in his 90s, and he had what we call hypochondriasis. Every time he had any little thing go wrong on his body, he would have to he'd make his wife take him into the emergency room. And this was happening 2 or 3 times a week. And so she got tired of taking him in and spending that many hours in the ER. So she brought him in for therapy, thinking it was a compulsion. But really what it was, he was terrified. And we traced the terror down to when he was in his 50s and he had angina attacks. Many thought he was going to die. And that he got over that, and then it didn't seem to bother him. And when he was in his 90s, when he is getting frail, then he, whenever something started to go wrong, the terror of him dying came up. Now, the way you work with EMDR and Terra is very hard. I've done it. People with EMDR, you have to actually feel it. And it's just, I thought he would die on me if I actually did it. I mean, he was frail. He couldn't handle that kind of intensity.
Having him relive the terror.
Yeah, that would just be too much. And so I thought about, well, let's try this technique, okay? And the first question I asked him is, can you feel the pain underneath the terror? And he says, no. Now I'm desperate. So I say, okay, what color is the terror? He said blue. We cleared it out. And about 7 minutes later, we're finished. And I said, how do you feel? And he says, well, pretty good. I went, okay. And but I don't really know if anything has changed, right? So 2 weeks later, he comes back in, and I asked his wife, not him. I said, how has he been doing? She said, ever since that session, whenever he had an issue, he would just call the doctor and make an appointment like a normal person. And that was the end of it. That's when I realized that you could release not only pain with ImTT, but terror as well. So what I ended up developing is not just new protocols like that, what I call the first one was the pain terror release protocol. So you can release pain or terror using this breathing visualization. But beyond that, I found that an entirely new understanding of psychological dynamics called the survival model of psychological dynamics. And what I mean by that is, who would have guessed that pain underlies guilt? And instead of processing the guilt, you process the pain underlying the guilt. And then I discovered that pain or terror underlies shame. And so by releasing pain or terror, whichever one they identify, the shame goes away. And you don't process the shame, you process the pain or terror. And so I not only developed new protocols for processing things so that you can release the most intense pain, the most intense terror, the most intense guilt and shame can be released without the person ever having to really experience it. As long as they can tune into it enough, as if from a distance, they can release it. And so and because of this, I was able to discover an entirely new form of psychological, a new conception of psychological dynamics that I call the survival model. And it just kind of grew from there. So it's not only that I developed new processing protocols, which are much easier than EMDR on the person to do, but also discovered a new way to target and identify and target what psychological dynamics to be most efficient at helping a person change their behaviors and their feelings.
Now, how does those anecdotes that you told me, I'm not hearing about positive feelings and getting rid of the positive feelings associated with something. So is that something different?
Okay. So it's the case of the stupids. I had a woman, so this was going along really good, and people were doing it was so much easier. I was still using EMDR, though, at this point. I was still releasing the feelings before doing the traumatic work, and then doing bilateral stimulation afterwards. Because what happens is it's just so much easier to do the EMDR if the intensity of the feelings has been reduced by 90%. So I was still doing the bilateral stimulation at this point. But what happened was one time is that I had a woman who's super intelligent, and but she thought she was stupid. And she was really a brilliant woman, but she had this intense belief that she was stupid. And so we released the pain of being stupid, and she said, "Yeah, it doesn't hurt anymore, but I know I'm still stupid." And that meant, okay, I don't have something right, and I'm missing something here. And then I developed the image deconstruction protocol. And it's basically just another simple type of process where a person, she focused on the image of herself being stupid and destroyed it. I won't go through the whole process now because you have to repeat it several times and then clear it from the body. But after that, she no longer thought she was stupid and realized how ridiculous it was. Now, what does this have to do with feeling states? All right, feeling states is an image. So if I were to take the gambler, he would have the image of playing Texas Hold'em and the feeling of being a winner linked together. And what I would do is have them see that image and then pixelate it like you would see pixels on a TV screen, and then destroy the image. And repeat and repeat and repeat doing that, destroy it, redo it, recreate it again, pixelate it, destroy it, and do it until they cannot recreate it again. And it's a blank screen. And then the last step is to clear the pixel particles from the body. I won't go through that detail too much. Anyway, and what I would do with a feeling state is exactly that. So I would have the gambler think about playing Texas Hold'em, feeling that he's a winner, seeing that in the image, pixelate it and destroy it until it cannot be created again. And that turned out to be an incredibly efficient way to clear feeling states.
And this is done in a 1-hour session?
Yeah. Feeling states are pretty fast to clear.
1-hour session and they're done.
You know something, even with EMDR, it was fast. Feeling states are very easy to clear once you identify them. The challenge for therapists is to identify what exact feeling is there. You can't just say, I feel good. That's not going to work. You have to precisely identify it. So if it's a feeling of belonging, a bonding, a feeling of special, a feeling important, you have to identify exactly what the feeling is that they're looking for.
And does that take multiple sessions to identify that?
Depends on how good you are. Most of the time, it only takes, I don't know, 5 minutes once you're experienced at it. It took me, when I was first figuring out how to do it, it took a while.
But you're down to treating people in and out, someone you've never met before, and identifying the feeling state and erasing it in one session.
Probably, yeah. That's only part of the treatment, but yes. Now, you can have multiple feeling states associated with any one behavior. For example, smoking. Very likely, I've seen 7 feeling states with smoking. But what happens is usually the first feeling state they come up with, the first fixated positive memory they identify, is the most powerful one. Okay. And it changes. And after you clear a feeling state, behavior changes immediately. Now, it doesn't take time. It happens immediately.
So let's stick with the compulsive gambler and getting rid of that good feeling that he had when he won the big jackpot. And now you've managed to get rid of that. He can't reassemble it in his brain anymore. What next? Because it still was based on some type of trauma that would cause him to be the type of person who would become addicted.
Now we find out, now we have to identify what the trauma is and clear that one that underlies it.
And how do you do that?
Well, what's interesting is a lot of times as you're clearing up the feeling state, the traumatic memory surfaces just right there. But if, let's say, it had an intense need to belong, and you might ask, where in your life did you feel, what is a negative belief you have about yourself that you don't belong? I'm no good. When you think back in your past, is there a particular memory that really evokes that feeling that you're no good? Boom, there we are. We have a trauma to work on.
And then how do you work on that trauma?
Process. Okay, so let's say the trauma was their mother yelling at them and saying that they're a miserable person, horrible kid, you're terrible. Okay, that's very painful. We'd release the pain of it, and then it could be that there is something else that actually the EMDR overlooks is the shock. Every traumatic event has shock associated with it. And what shock does is it numbs the feelings, and I think that's what causes actual fixation. And then I would clear the shock. If it's terrifying enough, there's likely to be the feeling of frozen underneath that. So using a form of the PTRP that I described, the breathing visualization technique for releasing a feeling, and then do the image deconstruction protocol to destroy the image of the mother calling him names.
Mm-hmm. Yeah, shock is interesting because that's probably what causes you to retain memories. If I think back to my childhood and think about the things that I remember, on the one hand, it seems kind of random, but on the other hand, it's probably things that were shocking at the time, right?
That's exactly right. And one of the problems with EMDR is there's concepts that they don't even have to work on. So they don't even work on the shock. They could, they just don't. They haven't discovered that. And with ImTT, it's pretty obvious. And you do another type of release by releasing the feeling of shock.
But with ImTT, if we're talking about releasing the very bad traumatic memory, the mother, let's say, even beating the child and telling the child you're no good, do they have to relive that to help release it?
No. As a matter of fact, so if the person were thinking or that, and let's say they were terrified, the mother's face, they're only supposed to feel it to the extent that they can see it from a distance. So,
whereas, with EMDR, do they relive it with EMDR?
They're much more likely to relive it that way because it's, yes, basically.
So that's the primary benefit, you believe, of your technique is the person not having to relive the trauma.
That's one of the primary benefits of it, in that it releases the intensity of, it releases the pain, releases the terror without the person ever having to even experience it. And so what happens is, I've had one woman who had been sexually assaulted about a year before. And they had done EMDR, and it had actually made her worse because every time she even thought of the memory, it was just, it would re-traumatize her. And so she's sitting in my office, and her legs are shaking. I mean, they are just shaking, mile a minute there. And this was, and I knew what had gone on, but I didn't ask her about it. But she was just sitting there terrified. And I said, why don't we just release the Tara? I know you look like you're really terrified. Why don't we just, I don't want you to tell me anything. Don't talk about it. Just release the Tara. I'm going to help take you through a simple visual breathing visualization technique. That's all we're going to do. Don't tell me anything. What color is the Tara? So she told me, I took her through this. We finished about 20 minutes later. And by the time we got down to her spine, her legs had stopped shaking at all and never shook again. So we went and finished that. And then I thought, maybe now we can, my idea is, let's tell me about the event a bit. She couldn't tell me about it. So I made a guess that what she's experiencing is intense shame. So I said, don't tell me about it. Does that shame feel painful or terrifying? Just tell me that. Don't tell me anything else that goes on. And she said it was terrifying. So we cleared that, the Tara underneath the shame. We finished this about 20, 25 minutes later. And all of a sudden now she could start talking about it. So we talked a couple minutes and about what the event was. I didn't need more than that. And then we deconstructed it using image deconstruction protocol. And that was the end of that.
So this might be a better question for David Pickup, but first of all, is this the first you've learned that people are using your therapy as reparative therapy for homosexuals or transgenders?
Yeah. I mean, people take my workshops. I don't know what they do. If they were to consult with me, I also have a lot of times after people take my workshops, they'll consult with me on particular cases. That's when I actually find out who they're working with. But yeah, I haven't heard anything about using it for reparative therapy.
Yeah. So, well, David and their group have discovered, based on their research, even though it's controversial, but they've published a book on it, that homosexuality is linked to childhood traumas. Most often, if we're talking about a boy, a traumatic issue with the father, an abusive father, an absent father, lack of making a connection with a close male connection. And that is the trauma. That is the childhood trauma. And he was using EMDR to take them back to that trauma and having a lot of success with it. Here, if he uses, and now he says he's using yours because he says he's even having more success with it. And, the typical person that comes in is it's a man who's had homosexual feelings, but's been trying to suppress them for whatever reason, has decided, he prefers not to be a homosexual, and marries a woman, has children, still having trouble repressing these feelings. Now he's out cheating on her on weekends with another man, and doesn't want to wreck his family. So he goes in to get therapy for this. Now, there's a lot of states that would like to make this therapy illegal. In fact, the state of California says it's illegal for anyone 18 or under to get this therapy. There was a bill last year that David Pickup was very out in front of trying to oppose that would have made it illegal even for adults. So that man who wants to save his marriage and stop cheating on his wife with other men, it would be illegal in the state of California for him to try to treat those feelings. I think that's outrageous. That we should have freedom over our own minds and bodies to live how we choose to live, whether we choose to live gay or straight. But anyway, that's the typical type of patient, though, that David was dealing with. So presumably he would be taking that person back to the childhood trauma that he had as a child, and he finds that every single one of them that comes to him, he can identify the childhood trauma. Every single one had a traumatic incident. With yours, where you add the positive feelings, I'm just wondering, and again, I guess it's a better question for David Pickup, but would you add in there, the first feeling he had being with another male and the positive feelings that he had associated with that, and try to reduce that?
Well, yes. Okay. There is, it depends. It's the quality of, so I had a man who was both married and fit that criteria, and he had um, homosexual relationships with the guys, but there was this compulsive quality to it that was different. You can feel the difference between somebody who's generally interested in other men or women, whatever it is, and somebody that it is a compulsion. There's a different quality to it. And if it's a compulsion, so with this guy, it began when he was sexually abused by his brother when he was 5 years old, but it was very pleasurable. And that feeling of connection that he got was what he was seeking. So it got activated later on in his life, and that feeling of connection was linked with men. And certainly when we cleared that feeling state, he no longer had any interest in having a sexual relationship with men. That, in my mind, is very different than being truly gay. If there is a trauma or a feeling state underneath that is causing a particular behavior, you're not really you're not trying to manage behavior, because I never try to manage behavior. What I try to do is clear the underlying psychological dynamic. So if there's a trauma there and it changes a person's behavior by doing that, that's healthy.
Yeah. Yeah. I mean, what they would say, again, it's controversial, but what they would say is that every homosexual has some trauma from their childhood
Well, every person has trauma from their childhood. So that doesn't mean anything.
Yeah. Well, he would say the type of trauma that leads to it, but I can send you their book and you can see what they say about that. But let's move on to other things that we've covered on the show. And that is addictions. So would you say that people that have substance addictions or substance abuse, all of them have some trauma from their past that needs to be dealt with?
Sure. I mean, anytime you have an addiction, addictions are caused by two different psychological dynamics. One is the positive feeling that they get from doing it, and the other is avoidance of feelings. So a person, a gambler, so they gamble so they don't feel anxious, or then they smoke when they feel loneliness. So you have two different dynamics. In clearing addiction, you have two different psychological dynamics you have to solve. You have to solve the feeling state, the positive feeling, and the underlying trauma. But also people just use it for avoidance. Something that has nothing to do with the feeling state whatsoever. People, so any behavior can be used in multiple ways. So a person works too much in order to avoid feeling empty, something like that. So there's also avoidance. And so you have to process those underlying psychological dynamics that they are trying to avoid.
Is there always both the trauma and the positive event that they're seeking to recreate, chasing the dragon?
Sometimes it's just avoidance. Sometimes it's just avoidance, and sometimes it's just a feeling state. So I've had people with sex addictions who it really was about the positive feeling. And once we cleared that positive feeling, the feeling state, they stopped doing it. Now, the thing is about sex addictions, I've worked with hundreds of so-called sex addicts. Not one of them were actually addicted to sex. What they're really addicted to is a certain feeling. And it may not have even occurred during the sex act. For example, with one man, whenever the woman took off her clothes, he felt manly. For another guy, it was, for the very first guy I worked with a sex addiction with, was when I was talking with about, his having sex with women, his eyes didn't light up. And anytime you're talking about the feeling state, it's exciting to people. Their eyes light up. Well, I knew something's wrong. It doesn't sound like he's even enjoying it that much. So I said, what do you do beforehand? And he says, he's about getting their phone numbers and dating them and stuff. And that was exciting, but it didn't seem to work. didn't seem to be the big deal. So I said, well, what do you do afterwards? Well, afterwards, I go tell a friend of mine what I've done. When his eyes lit up.
I had a friend like that.
Okay. And what they're looking for, what he was looking for is admiration. Now, where that came from was in high school, his buddies had a contest of who would get the most number of women, have sex with the most number of women. And he unfortunately won. So he's feeling like big man on campus. And that became a fixated memory for him.
And what was the trauma for him from childhood?
Oh, childhood trauma stuff where he didn't feel good enough.
Mm-hmm. What about pedophilia, since we're talking about Epstein now?
I haven't. I worked at Coalinga State Hospital for sexual offenders for about 1 year and 9 months. But they didn't really let me do any individual therapy. Everything was group. So, but I would hear their stories. And, I don't know. Is it nature or nurture? Some of them, it seemed really to be, that's where they got fixated on when they were a child. I have worked with somebody who liked child pornography. And when we cleared that particular feeling there, stopped having any interest in it whatsoever. So I haven't done enough with it. And part of the problem is if you're in the hospital for it, you've been in prison for it, you don't want to go there because it's been so horrible for you. Because you have to be able to actually acknowledge it, feel it to some degree. And the people who are not in the criminal justice system don't want to admit it because then you go to prison. Mm-hmm. So that's not something. I've had some people be interested in maybe doing the research on it, but nobody has come up with anything that I know of. Mm-hmm. So I don't really know. Is it nature and nurture? Maybe it's some are one and some of the other. I don't know enough yet. We have to start doing research on that.
So going back to addicts, you've got people being sent to rehab centers, 30-day rehab. Mm-hmm. Then the rehab center sends them to AA meetings. Make sure you get yourself a sponsor. Make sure you work the steps. If you're starting to feel the craving, get yourself to a meeting. How do you feel about that?
It's behavior management. And it works as well as behavior management usually works. Not very well. Okay. They haven't cleared the trauma. They haven't cleared the feeling states. What do you expect to happen?
And what percentage of therapists are doing EMDR, number one, and then secondarily ImTT? Because I had never heard of either of these things. I'm not sure they're happening. Are they happening in any treatment rehabilitation centers that you know of?
Oh, absolutely. They are definitely using EMDR. They're not. ImTT is much newer. I mean, my first idea of this, I think, was 2013, something like that.
But hold on a second. If I go, Malibu's down the road from us. Yep. I go to Promises in Malibu.
Yep.
For 30 days for my heroin addiction or whatever addiction. Are they using EMDR on me?
I have no idea. I don't know. Most of them don't. Some of them do.
Yeah, I mean that's my.
But if you don't clear trauma, I mean, one of the fascinating and really disheartening things about the state of psychology is EMDR has been around since 1989. The first paper was Shapiro published first paper on that, and it is up until ImTT. It was by far the best way of dealing with trauma, and I have people and so many therapists. Probably most therapists are not trained in how to deal with trauma. And yet trauma is a fundamental aspect of why people are having dysfunction in their lives.
Yeah. What percentage of people who are having dysfunction in their lives, it's a result of prior traumas? What percentage?
100%.
100%.
100%. There's two different dynamics. And this is what overlooks, and that's neglect. Trauma is easier to identify because there it is. It's somebody hits you, boom, you can see it. But what about when no one's there? What about, or maybe they're there physically, but they're not, but there's no good interplay at all between parent and child. And they're left with this feeling of hollowness or emptiness. That actually is, I have seen people who didn't want to release their pain because underneath the pain was a feeling of emptiness, and that's worse. Mm-hmm. There's what I call the feelings of absence, loneliness, feeling of emptiness.
Well, David Pickup calls that a trauma because that is the trauma that he's uncovering with many, that the absence of a father not being there can be a form of trauma.
The processing is different. The identification is different. I do not want to conflate the two, to put the two together.
And I may have that wrong, but I do know that they're finding a big correlation between the absence. I don't doubt it. And issues.
I don't doubt it. I mean, the feelings of absence are even more powerful motivators than trauma.
And you're just making the point that it's more difficult for EMDR to treat that.
Yes.
That type of quote unquote trauma.
Whereas with ImTT, it's very simple to treat.
So I'm a big Howard Stern fan, and he loves to talk about how often he sees his therapist and 2 times a week, 3 times a week for 20 years. I mean, is that type of therapy appropriate in light of what you do and people coming in and out in one session and having such dramatic changes?
It means they're not really processing things.
Someone should not be. Someone should not be in therapy. Just to be clear, someone should not be in therapy for years.
No.
They shouldn't be in therapy.
I mean, it could be that they had such a horrible childhood that they're having a trouble even identifying anything, and that would be different.
But I mean, that is when people think about therapists and therapy, that's what most people think about. They think about seeing your therapist once a week, if not more.
Yeah, with ImTT, you get changes almost from the beginning. Usually from the very first session if we do a double session, because it takes some time to take a history taking and stuff. But people have very profound changes very fast with ImTT, much faster than with even EMDR. And EMDR is way beyond. If you're just doing talk therapy, you're not changing anything. Not really. They adjust to it. They understand it more. They're not so, freaked out by it, perhaps. But it doesn't change the underlying psychological dynamics.
But you're not very good for their business.
No.
You're not even very good for your own business.
No, you're right. I mean, I have people come and, we do 5 sessions and they're going, I'm a lot better now. That's over. I'm going, okay.
I hope you charge more per session than most therapists.
No, not really.
What's the average price of a session?
Oh, I charge $200 for 50 minutes, 50.
Mm-hmm. So, but this could be one of the reasons why we don't hear more about this, because
it's still just, something I'm still. I mean, I've still been developing it, so I haven't been. You might say not number one, I'm not much of a marketer, but I've really been developing it, and I only have felt that it's fairly well developed actually in the last year. People have been using it for now years. I've been teaching therapists how to use it. And sometimes, especially near the beginning, I was driving them nuts as I would keep changing the names of the protocols as I would discover new things. So, the newest protocol I developed last year that made a huge difference in the way of treating for things like social anxiety, for example. And so it's been developing, and I feel like it's developed conceptually well now. And I got lots of feedback from both therapists and the clients of those therapists that it's really working well.
Well, congratulations. I think it's an amazing breakthrough, just as I think EMDR is a great breakthrough. And it's very disappointing to hear that that's not more widespread.
Yes.
And I hope yours becomes more widespread. I mean, ballpark, how many therapists out there are practicing your therapy?
I've trained about 150 right now.
And what about EMDR? How many out there are doing EMDR?
Well, the problem you always have is how many people did the workshops and how many people really got certified. I mean, there's a huge difference between the two. EMDR has a much steeper learning curve. One of the advantages of IMTT is that it has a gentle learning curve. That is, you can just start using some of it in your practice, like releasing the pain and terror, and keep doing what you're already doing, and then keep adding to it. It's a real advantage to IMTT for therapists.